Hi, I'm Nicole Bitencourt, and I'm here at the national meeting in Chicago. And I'm here with Dr. Kimberly Depatro, who's going to tell us a little bit about the difficulties and with transition of care from pediatric to adult rheumatologic care, and just a little bit on the project that the work that she did and the things that she found out at her institution. So, Dr. Depatro, thank you for being with us today. So, tell us a little bit about why this is an important topic.
Oh, do I hold this? Sorry. Thanks, Nicole. Transition and transfer of care is a really important topic because we have so many patients from the pediatric side that are having to grow up and mature and become adults, and it can be a tricky process. And so the project that we were looking into was really trying to figure out whether some transition improvement measures could make a difference with regard to the time to transfer for our patients, and hopefully down the line will set the stage for more improvements as well.
Okay. So as we know, this is a very difficult area to address, and sometimes these pediatric patients get kind of lost and have poor outcomes from that. So tell us a little bit about the interventions that your institution instituted that helped with the transfer of care from pediatric to adult.
So there's nothing really rocket sciencey about the initiatives that we started, and I think it's really important to start with sort of something basic and doable. And the pediatric rheumatology group at UCSF at our institution really started putting into place transition policy. They also worked on looking for EHR. They looked through the EHR to see which patients were going to be transferring based on their age, and would have a month, Q 3 months, so every 3 months they would have planning rounds to discuss those patients and focus on what the next steps would be before they were going to the adult side, so that there would be a smoother transfer process. And so those were the three main things that they started with.
Okay, well, those sound like things that could be doable for most institutions, hopefully. So tell us a little bit about what you found with the institution of those policies.
So initially, the group that we looked at from the historical time was from 1995 to 2005, and that was sort of the transfer initiatives. And then the group that we looked at more recently was from 2012 to 2017. And ultimately what we found is what we were looking for were time to transfer, which was so the time between the last pediatric visit and the first adult visit, and then successful transfer, which we defined as the time to transfer as less than 6 months, and then having at least 2 visits on the adult side within 12 months of time. And so what we ultimately found is that we improved our transfer times from about 7.5 months in the sort of historical time to 3.5 months more recently after those implementations were in place. And then we also had about 54%, so a little bit more than half of the patients transferred successfully.
Okay, well, those sound like policies that we can all hopefully implement at our own institutions. And if you want more information on this topic, you can find us at Room Now.